morning, Nevada. This is Tina Drago and Jim Godwin coming to you live from Beasley Broadcast Studios. It's Healthy Nevada Day. We have in our studio Matt Engstrom with Caremore, and he's going to talk to us about the open enrollment and all the wonderful things that people are going to be privy to,
Yes,
right?
good morning.
Good morning. How are you today?
I'm doing swell. How about you?
Well, as you know, I need a cup of coffee, but other than that, I'm doing okay.
Wish I could help you out.
So, tell us about open enrollment. When does it start? When does it end? What should people be looking for? I've had a ton of mail.
Yes. Political mail or Medicare mail?
Medicare mail.
So both this time of year, and it's a little bit crazier than we're used to. In addition to all the political mail, we also have a slew of information coming our way around Medicare.
Yes.
And that is because on October 15th begins what we call the annual enrollment or annual election period. And this time frame runs until December 7th, which is Pearl Harbor Day.
Okay.
So during this time of year, basically anybody who has a Medicare plan needs to review their options. What do they have? What's changing? What do they like about what they have now? What do they don't like? Because it's during this time of year where you can add things, you can drop things, you can change your coverage. It's a very chaotic time of year for a lot of people.
A lot of people don't even realize that they can change. They think if they're in it with somebody, they have to stay in it, or there's going to be a penalty, or they're going to lose some of their benefits.
Yeah.
I mean, what's the reality of that?
The reality is you need to look at what you have and look at what's changing. Every year there are changes. Some plans are going to have substantial changes. Some will have minor changes. But when you talk about prescription drug
But even
plan,
your existing plan will have changes.
Oh, yeah.
Okay,
Yeah.
so there's going to be changes regardless.
Yeah, I mean,
Okay.
if you have a Part D plan, prescription drug plan, if you have a Medicare Advantage plan, those two specifically are annual contracts with Medicare. So whatever you have in front of you for the year 2016 can and likely will change for 2017.
Okay, so I'm going to ask you to repeat that. Okay,
Yeah.
people, wake up, listen. This is really important. Matt, say it one more time.
Yes, if you have a prescription drug plan or Part D plan, if you have a Medicare Advantage plan, both of those are where companies contract with the federal government. And in both of those cases, these are annual contracts.
Okay.
So every year there's a renewal, and subsequently every year there are changes to your policy. Some changes are huge. Some you don't even notice. But the point is there are changes. You need to look out for what those are.
Well, I know a couple of years ago, a major carrier in Las Vegas used to allow out-of-network providers
Yep.
on their HMO plan or their Advantage plan. And then one year they stopped and they allowed no out-of-network providers.
Right.
And it was chaotic.
Right, and that's probably the point of service option you're referencing that looks great, sounds great, but in reality it can be quite a cluster.
Yeah.
And that's a good point to bring up because we continue to stress to people you have to look at your book. You have to look at these changes or look for these changes. The challenge is when we look at if somebody who's on Medicare were to save every single piece of mail that they get during this time of year, they would have at least 12 inches, if not 2 feet, stacked vertically. So it's
Holy
understandable.
moly.
That is a lot, isn't it?
That's insane.
Yeah.
But it's the reality. And so it's easy to get swept up in this chaos or this frequency. You have so much mail coming your way. First thing you want to do is take the stuff that comes from the company you have right now and set that aside. Look at that first. Highlight, circle, cross out things you like, things you don't like. Then you can look at the rest of that pile of mail and figure out what you want to do.
Okay, so I probably, like most people, I just look for where the free meals are.
Well, you're a little late to the game. Free meals are no longer part of our industry. They stopped that about 5 years ago. But I like how you're thinking. Free coffee, yes. Free meals, no.
Okay. So things are going to change no matter what. So
Yep.
everybody be prepared for that. And I
Yes.
think that's yes? What do
Oh,
you,
I just have a question for Matthew. These changes to your Medicare, they'll just come through. Is there the one specific mailing that highlights all those, or do they just come throughout, kind of tucked here and there?
That's a great question. And when you talk about that, every company sends out what's called an ANOC, Annual Notification of Change. By law, they are required to send that. So to answer your question, Jim, yes, there's a very specific piece of mail that comes to you. It usually has stickers, disclaimers, large words on the outside of the envelope so you know what that's for. And that, to your point, is exactly what you want to look for and set to the side.
Does that come out before this craziness, or does that come out during the craziness?
It usually depends on the company. Comes out usually towards the end of September.
Okay.
Yeah. But the biggest thing that I'd like to stress for folks during this time frame, number one, look at your books. Look at them now. If you have a personal situation or medical situation, that's different, but you have to take, maybe it's 15 minutes, maybe it's 2 hours. You have to take the time to look at this stuff so you know what direction you're going to go. Some people, they're going to stay where they are, and that's fine. Others, they're going to look at their book and go, oh, wow, I'm not happy with this. This is bad for me. I can't afford this, et cetera, et cetera. And then where people really have an opportunity is to look at the plans in terms of their health. So being in this industry for 12 years, what I noticed is that all of us, including me and you, when it comes to you're guilty too, when it comes to our health insurance, there's two things that everybody looks at. Do they have my doctors or doctors that I think I want? Mm-hmm. And then what's the cost? Everybody looks at these two things. And that makes sense, right? You want to have physicians or providers you're comfortable with, you might have a relationship with. That makes absolute sense. Secondly, I want to get the best price I can. If you have my doctor, but it costs me $100 on your plan or $10 on the other plan, then yeah, you're going to want the plan that costs you $10.
Right.
Where we fail to look further is, what does the impact of that plan have on our health? One of the best ways we talk about this is, if I go to the hospital, let's say I go to Summerlin Hospital or Mountain View Hospital, and I'm there for 7 days. I'm a whole week, 7 days. And I don't pay that bill. I don't mean I skip out on it. I mean the bill for me is zero. I ask people, is that a good value?
Well, I would think so.
Most people say something to that effect. Yeah. And what we say back is, you're half right.
Okay.
And they always go, what do you mean by that? Obviously, from a financial standpoint, if you can get in and out of the hospital for 7 days and you don't pay a penny, clearly that's a good value for you. The question, though, that you should also ask is, why was I there 7 days? What type of health care did I get over 7 days? How many different doctors did not look me in the eye, did not talk to me, did not talk to my primary care, did not explain to me or the family what's going on or why I'm there, what's the plan to get me out? These are things you want to look at. If I go to Mountain View Hospital tomorrow at 4 p.m., I'm going to be seen, admitted, or treated by whatever doctor's on call that afternoon. Mm-hmm. Now, if I'm there overnight, is the doctor that saw me at 4 p.m. going to be there in the morning?
No, probably not.
Now, what if I'm there at 4 p.m. the following day? So now it's 24 hours later.
Maybe.
Now you take that same sentiment over 7 days. How many different doctors am I going to be seen by? How much is going on behind the scenes that I'm not privy to or I don't know about? Mm-hmm. The reason we bring this up is there are health plans out there that do more than pay your copays. They do more than provide you medication coverage or coverage in the hospital. And where that has an impact is on your health. If I have a spreadsheet in front of me that says that my hospital bill is going to be zero, but I'm going to the hospital 4 times a year, that plan's not helping me. All it does is help me avoid large catastrophic bills.
Right.
The question should be, what can you do to help prevent me from going to the hospital 4 times a year, from going to the ER regularly? And that's where I think people, and I am generalizing here, but lose sight of what you really should look at, because cost is important, access to care is important, but those things should take a second step or a second seat, or rather a back seat to your health. So these are things that we really encourage folks to look at, because numbers are important, but your health is the most important. Does that make sense?
That makes perfect sense. And I do understand. And so how do you know if there's an advocacy group or not for you? How do you know if there's advocacy involved?
Well, you ask the company or you ask the representative that you're sitting with. You ask them point blank, things like, what do you do for my health? One of the things I love to promote people asking is, if you're sitting down with an agent, maybe it's an agent from a health plan, maybe it's a broker, ask that person, where are you going to be when I need help? Where are you going to be when I have a problem?
Right.
And then shut your mouth and be quiet and see how they respond to that question. Because on the other side of the coin, there's a numbers game. If you're in the sales organization of any of these health plans, it can be a great time for you and your family, because you can have a lot of new sales and make some pretty good money. But ask that agent where they're going to be for you when you need help. Ask them, what are you going to do for my health? What programs do you have for me that will help me keep my health where it is, or maybe help improve it? You know,
Do they have a hotline normally?
every company is different. It's pretty much standard this time of the time frame we're in to have a nurse line, and, 24-hour nurse line. One good question that's a good thing to bring up is when you call that nurse line, are they local or are they virtual? Sometimes the company you're with, those nurses may be in New York,
Right.
or somewhere else. Are they local? Do they have local infrastructure that you can rely on or call for help or for support? The best example that we see, there are programs out there that offer gym memberships at no cost. There's the two most common would be Silver Sneakers and Silver and Fit. Great organizations. They do a great service, and what they do is essentially they pay the way for someone who's on Medicare to go to a gym for no cost. They can work out for free.
Get healthy.
The problem is nobody goes.
I don't go. I don't like the gym.
Okay, I could pick on you a little. I mean, I could
Pick
even
on
ask.
me. I don't go to the gym.
What do you do at home?
For workout?
Uh-huh.
I have a core exercise routine I do, and then
Okay.
I go work. I walk about 2 miles a day, and then I have a stationary bicycle. So when I am on the computer, I'm biking.
So you do something, right? You do something.
Yeah,
whether
I
it's
just
at
don't
home
like
or at
gyms.
the gym.
I don't.
But here's the issue, though. There are hundreds of thousands of people, probably in all reality millions across the country, that have no cost, free access to a gym, and they don't go. Why?
Well, let's ask that question. There must be a psychological reason. I don't like it because of the smell.
That's a new one. If that's your main deterrent from going to the gym,
like
just
that,
find
Jim?
a new gym.
I did like that.
I haven't heard that one in 12 years, but I can see where you might have an issue with that. Okay, so we don't
How
like the smell.
aware-
What? What?
How aware are people that they have this benefit?
Are they aware?
Yeah.
Yeah, they are, Jim, and that's actually where
Okay.
we come across the problem. The gym membership at no cost is often part of the sales pitch.
Mm-hmm.
So Tina, if you
Okay.
join my company today or now or whatever sales tactic I use on you, you're going to get to go to XYZ gym for nothing.
Woohoo.
And then you go, wow, that's great. And then you don't ever go.
No, I'd tell you, Matt, I'm not going to go to the gym, but what else do you have to offer?
If we have a good smelling gym, maybe you'll go. But
Maybe.
there are other reasons people don't go.
Can we start saying fitness center instead of gym? Because I'm feeling a little self-conscious here, guys.
Okay. a fitness center. Yes, Jim. We can whatever word makes you feel better.
Talking about smelly gyms.
I'm sorry, Jim.
That was just a
Fitness
joke,
complex. So there's the most common are I don't know how to work out anymore. Maybe I have an illness now. Maybe I'm old. Maybe I'm not as mobile as I once was. There's nobody to support me or give me guidance or give me training. I don't like the loud music. You hear that more commonly than you would think. I don't like heavy metal. I don't like hip hop. It distracts me. There's too many young bodies running around in their tight shorts and short shorts that distract me from working out. The most common acceptable answer is I can't get to the gym. I don't have transportation. That makes sense.
Yeah.
The point is, even if you have a benefit like this and you're not using it, there is no benefit to you. So ask these organizations, what do you do to give me guidance or coach me? If you're telling me I can go to the gym for nothing, but I don't know how to use the equipment, I don't know how to lift weights properly or ride on the bike properly or do the incumbent machinery properly, it does me no good. So ask the organization or the company you're with or you're proposing that you be with, how do you help me do you help me learn how to use this stuff?
Mm-hmm. Do they?
Some do. And of course I'm going to be biased and tell you that Caremore does.
Okay.
We do show you how to use the gym. We do hold your hand, not literally, but we do make sure you understand. We do give you guidance. We do give you training in the fitness complex gym. We do those things. But many companies, they don't. They just pay your way, and then it does nobody any good. So,
And the gyms aren't incentivized to really give you, what do you call it, personal trainers or anybody to help you if they're just getting their check every month.
correct. And their incentive is to come to you and say, Tina, you're with XYZ company. They pay your way.
Mm-hmm.
So because you're not paying us, have you ever considered a personal trainer?
Yeah.
Have you ever considered paying us $100 an hour for some guy or girl to check their iPhone while you struggle on the weight bench or whatever?
It's an upsell.
It is.
Yeah.
It is. And these are things that, Caremore is a clinically led organization, and we're led by a physician. So when we're out there in the community, your number of doctors, your cost of care, of course, those things are important. But we ask people to think beyond those two things, and we hope your listeners think like that too. If Caremore is not the right fit for them, that's fine. As long as you've had that discussion with yourself or your family, and you've got some semblance of some answers to these additional questions, then you can make an educated decision.
No, not so far.
Not the fitness center, but Jim?
No, Matthew's eloquence has left me satisfied so far.
So he's got great, he does Medicare well. He gives good Medicare.
Done it a long time.
On the radio. So yeah, it works out well. So there's one little thing that I want people to realize. All this stuff's coming to them, and they're going to start looking around. Yeah. And they may even start asking questions, and they may even go to some seminars and log in their name if they went and they checked this out. Which one is going to be the one they decide on when they start seeing multiple places?
Well, it comes down to what fits the individual. This always comes back to cost. Mm-hmm. A lot of people are going to flock to organizations because the cost is minimal or is zero. And certain numbers like 0 jump off a spreadsheet or they jump off a piece of paper. But going back to what I was saying earlier, those numbers are great, but you have to look at yourself as an individual. What are your healthcare needs? What prescriptions are you taking? Mm-hmm. What support are you not getting from your providers? That's something that we don't want to admit. The problem in Vegas specifically is there's too many people in our population and not enough providers.
Right.
So where that becomes problematic is time and communication. And when time and communication are a struggle, the patient suffers, not the provider.
Right.
So take those types of things, your own experiences, your diagnoses or conditions, the medications you're on, and try to find a plan that can match or best help to address those issues best.
Well, my question was more along the lines, we had a lot of patients last year that didn't even realize they switched insurances. Mm-hmm. I just went there to see what was going on. I just checked them out, and now I've switched insurances. How does that happen? Strong
arm sales tactics. You joked earlier about free meals.
Yeah.
And one of the things I said was that free meals have not been allowed since 2010, I believe. It's precisely because of what you're talking about. So back in Tucson, this is when this was most common. You could buy meals. You could do a full presentation, go to a buffet or a restaurant, and I would legitimately have 120 people listening to our presentation.
Right.
And those 120 people would all have a plate of food and drinks in front of them. Now, we would never strong-arm somebody over a meal to get their business. But what I have seen with my own two eyes is somebody stand up almost literally above somebody. So picture quote-unquote grandma sitting at a table. Mm-hmm. And some guy or gal in a business suit is standing above her while she's got like a spoonful of peas or something. And they say to her, "I will not buy your meal unless you sign up with me today."
Really?
That literally was happening.
Oh, that's bad.
Wow.
And for a while, the industry was kind of upset that the free meal thing was gone. But once we woke up, we realized this is actually a good thing because it helps us get away from these strong arm sales tactics.
Right.
Most commonly today, you're going to hear people say things like, "I'll always be there for you," or this is the best plan, which, by the way, you can't say. You cannot say your plan is the best.
Because it's subjective.
Yeah, it's prohibited by Medicare. You cannot say your plan is quote unquote the best. But people do.
Yeah.
People will still say stuff like that. And what ends up happening in a lot of cases is people get caught up in the moment. But I'm also really glad you brought up this scenario because, we're all familiar with this term buyer's remorse. They strong arm me. I signed up. I didn't want to sign up. Mm-hmm. What few people realize about this time frame is that if that happens, if you end up in a situation where you were strong armed and somehow you sign on the dotted line, you are not necessarily committed to that paperwork. The reason for that is Medicare has a rule called last application standing.
That's what I wanted you to talk about, yeah.
So if I'm strong-armed on October 30th, guess what? All I have to do is find a different company, could be the same one I'm with now, could be a different one for next year, sign up with them. And then that strong arm tactic, that sale I did not want to have happen on October 30th, it goes away. Whatever application is done by midnight on December 7 is the one that counts.
Okay.
The one that counts.
So you can go out and talk without being fear of having to say no to somebody. Just know that whoever you sign last is going to be the one you're with come January 1st.
Yeah, and be very mindful of how the individual that you're working with or you're asking questions of, be very mindful of how they interact with you. You know, oftentimes people who join Caremore this time of year, I don't know the percentage, but a fair amount will come to us and say, you know, I fell for the pitch. I signed up with a competitor's plan. And we'll ask them what happened. And they'll basically tell us they promised us the world.
Right.
You know, they said they could do this, they could do that, and none of that happened. What we prefer to do is tell people, look, there is no such thing as a perfect organization, and that includes us. If we are wrong, we'll tell you. If we don't know, we'll tell you. And people really, really seem to appreciate that type of honesty.
Right.
You know, I don't want to sit here and tell you, Tina, if you go with my organization, we're going to give you the sun and the moon and the flowers and everything else. We're not going to tell you that. We're going to tell you, here's how we do things. If you have a problem, if you have a question or an issue, call us.
Right.
We'll advocate for you. We'll work with you. And that is not as common as it should be when people are in this time frame.
Yeah, it's like a feeding frenzy with sharks.
It is. Absolutely it is.
It is. Well, Matt,
I have a question.
Oh, go for it.
Oh, sorry. I just have a question. Since Medicare is a federal health insurance program, when people have problems with, say, being strong-armed or stuff, and they would call like the federal government, or like how would they get like referred to like your organization if they're having problems with some other provider?
So that's a great question, Jim. There's a couple avenues in which problems or complaints are tackled. First and most common is to call the organization that you're with. That's the most common. Now, if you do call the organization that you're with and they give you the runaround or they don't help you, then your second recourse is to call Medicare. It is to call the Centers for Medicare and Medicaid Services, and they intervene. The value of doing that, Jim, is that CMS or Medicare oversees all of us. They oversee Humana, Caremore, United, anybody who's in this industry, we ultimately report to them. So you're going right to the source if there's an issue, a question, or a problem. This time of year, though, Medicare is swamped with phone calls, with online inquiries, all sorts of stuff. So you absolutely can, and some people will, and in some cases, some people should make that call. The thing that we'd really caution folks about with that call is try to get a handle or an expectation on timeline. You know, if I call in with a question or a complaint, try to get an answer. How long is it going to be before I get resolution or before I get a response? And like any organization, if you're not getting what you want, go a level up. Ask for a supervisor. Same thing if you're calling the organization you're with. Ask for a supervisor. Where we see people who call Medicare most commonly or most often is when they have a complaint against the agent. If the agent just lied to them, didn't tell them the truth, they'll call Medicare and say, hey, I met with this person this time. He or she said this. I feel like I was misled. I feel like I was lied to. And that's generally a good way to handle that. So to answer your question, Jim, you can call two different agencies. You can also call the State Department of Insurance, but most people will call the plan that they're with, or they'll call Medicare directly.
I really appreciate you coming in today, Matt. We whizzed right through this segment. Matt Engstrom with Caremore. If you have any questions, you can call your agency or you can call CMS. Go online. There's lots of frequently asked questions. And good luck. Good luck out there to our viewers. I also want to do a little PSA for First Person Care Clinic. We are hiring. We are hiring mid-levels and doctors. We're competitive. We have tuition reimbursement programs, and we need to hire some really community-minded providers. So give us a call at 702-380-8118 or email me at info@firstpersoncc.org. Looking forward to hearing from you guys, and I hope you have a healthy week.
Stay healthy, Nevada.
I love that. Take care. Bye-bye.